Hello everyone. Now, Kesha Transplant, we are a medical clinic and we specialize in hair transplants. But since we're run by a team of doctors, we realized that there is a big issue in Sri Lanka with diabetes and insulin resistance. Now, we felt the best way to contribute to our community is to have a free screening program for anybody who has symptoms of pre-diabetes. If we can catch diabetes early enough and before it happens, so if you can catch it in the early stages or in the pre-diabetes stages, then we can stop people getting diabetes. Now, diabetes is a really dangerous condition. It's a kind of a silent killer because it causes effects over a prolonged period of time. You don't suddenly wake up feeling ill when you get diabetes. Gradually, the rise in blood sugar levels, the uncontrolled rise in blood sugar levels, causes a lot of damage. It damages the blood vessels itself, and so you can put yourself at a higher risk of getting heart disease, getting strokes. It damages the blood vessels that supply the kidney, so you can get end-stage renal failure. Your kidneys can actually stop working, and you might end up needing dialysis. And the other thing it does is, over a prolonged period of time, because of the damage to the pancreas is the organ that secretes insulin. Now, the insulin is the hormone that we need to regulate blood sugar. What happens is when over a period of time we gain weight and our fat cells and our fat stores increase, the fat cells increase in size and the fat stores increase, we are less able to use the insulin that we produce to drive glucose into the cells. So it doesn't happen as effectively as it should. And you get what is called insulin resistance. That means that you're producing insulin, but it's not enough for your body to control the blood sugar. And so your blood sugar levels gradually rise, creep up until they pass the threshold where you get diabetes. When you get diabetes, then you need to start treatment. But if you start at the pre-diabetes stage, when your blood sugar is climbing up, you will never get to a point where you'll need to start treatment. So the best thing to do is to identify the signs and symptoms of pre-diabetes. Now, what are they? Well, actually, if you are overweight, all right, if you have central body fat, you have body fat stores that you can see visibly externally, this is also a good indicator that you'll have a lot of internal visceral fat as well. Now, there's an equal amount of fat stored around your organs, and this is the total fat in your body. This plus the dermal fat, the fat in your skin. So what you need to do really is to control and reduce this fat store. Now, how do you do that? Now, you see a lot of people exercising, you see a lot of people going, on Parliament Road, you'll see a lot of people walking every morning in the evenings. But if you look properly, you'll notice that most of them are still quite overweight. So what's going on? I mean, why aren't they losing weight? They're exercising, obviously, and hopefully they're doing it quite regularly, but still, there's a lot of people who are overweight, especially in Colombo and the big cities. And really the problem is the abundance of food. We have got used to having 3 standard meals, and we eat rice and curry. And rice itself is carbohydrate intense. It's rich in carbohydrates. And what happens is when we eat carbohydrates, the body is stimulated, the pancreas is stimulated to produce insulin. And what this insulin rise does is that it causes the buildup of pre-diabetes states. So gradually, when you eat more carbohydrates, your body has to produce more and more insulin to cope with that. And what happens is when you produce insulin, the insulin will drive the carbohydrates. Carbohydrates get digested to glucose, and that gets driven into the fat cells to be stored. And so over a period of time, our fat cells increase in number and in size. And what happens is we just don't have enough insulin to keep driving the glucose into our cells. So your pancreas essentially fails. And at that point, it doesn't produce enough insulin, and you get insulin resistance and diabetes. Okay, so eating a lot of carbohydrates is what has caused this. Now, the way to do this, intermittent fasting. Now, intermittent fasting is basically where you give your body a break in not eating. You give your body a time to relax every day where it's not having to produce insulin. This gives your pancreas a chance to recover. Doing an intermittent fast, you consume less calories during the day. So the best way to do it is to have a meal, have your last meal at night, and then not eat again till 12 o'clock the next day. Now, if you can, by doing that, you can have about 14 to 16 hours of not eating. The difficult part of doing that is that it's very difficult not to eat. Initially you will feel hungry, and so you can use a supplement, and it's available in our clinic. Basically, these supplements are food supplements, but they have very little calorie content. And what they do is they help you get over this period where you need to consume food, and they help you in your intermittent fast. So it makes it quite easy for you to fast after you had your last meal at night. You then don't have to eat again till about midday. After that, you can have your lunch and your dinner as normal, and giving your body a little chance to rest, giving your organ system, your digestive system a chance to rest. You will see over a period of 6-7 months that your weight will fall quite significantly. And you don't need to exercise, although exercise is beneficial for many reasons. You don't need to exercise to see this result. So if you need any more information about this, come and see our doctors and they will advise you. And all you have to do is book a time with us.